A colonoscopy is a safe and common procedure. It looks for early signs of problems in your colon or other parts of your digestive system. These problems could be things you can feel or things you can't feel, which is why getting colonoscopies is so important. Your colon, also called the large intestine, is part of your digestive system. When you swallow food, it travels to your stomach where it's broken down. From the stomach, the now mushy food moves into your small intestine, where the nutrients are absorbed into the bloodstream. Any leftover food is now liquid and becomes waste your body doesn't need. The waste then passes into your colon, where it is turned into a solid. When the solid waste is released from the colon, it's stored in a connected chamber called the rectum until you push it out through your anus. This is called a bowel movement, or poop. Poop may also be called stool. When your colon and all other parts of your digestive system work normally, you experience regular, pain-free bowel movements. A colonoscopy is done to screen for things like colon cancer and other bowel diseases. The important thing about these screenings is that when colon cancer is found early, most of the time it can be cured. It's recommended that everyone have their colons checked every 10 years, starting at age 45 until age 75. Between age 76 and 85, your doctor will let you know if you need to continue colon screenings. And after age 85, colon screening is not recommended. But you may have screening sooner or more often if you currently have a bowel disease like ulcerative colitis or Crohn's disease, or if you have a family history of colon cancer or colon polyps. Polyps are extra bumps of tissue that grow out of the wall of the colon and can sometimes be precancerous. Colonoscopies are also done if another test your doctor ran, like a stool sample or imaging test, found something that shouldn't be in there, like blood or a polyp. Or if you're experiencing a big change in how you go to the bathroom, bleeding, pain in your belly, loss of appetite, or a condition like anemia. And if you've ever had polyps or colon cancer in the past, colonoscopies are done as a safety check to make sure they haven't come back. And while many colonoscopies are done to screen for possible problems, they can also be done to help treat a bowel condition you already have. There are a few important things to go over before your colonoscopy. First, let your doctor know if you have any health conditions or allergies, especially if you or anyone in your family has ever had an allergic reaction to anesthesia. And let your doctor know if you had past surgeries, especially on your belly, because there could be scar tissue in the area around your colon that may make it harder to move the scope or see. Your doctor will also need to know if you have any metal in your body or loose teeth or dentures, as these things may affect the procedure. And for your safety, make a list of all the prescription medicines, over-the-counter medicines, vitamins, herbal supplements, and recreational drugs you take. It is important that your doctor knows all the medicines you are currently taking, because it may impact how you prepare for this procedure. Let them know if you take a blood-thinning medicine like warfarin, Plavix, Pradaxa, Xarelto, Eliquis, or any other kind of blood thinner. Your doctor may have special instructions for this before the colonoscopy. Also, find out when you need to stop eating or drinking before your procedure. This is important because if there's anything in your stomach and you throw up during the procedure, it can be very dangerous. If you don't follow your doctor's instructions for this, your procedure may have to be rescheduled. If you take medicines, on the morning of the procedure, your doctor may ask you to take some or all of them with just a sip of water. Lastly, if your procedure is done with sedation or anesthesia, you'll want to plan on having someone drive you home after the procedure is done because you'll be too drowsy to drive yourself. Most people say that getting ready for the colonoscopy is actually the hardest part. This is because the colon needs to be cleaned out before your procedure, and that involves some preparation on your end. Your doctor will give you a list of instructions that will tell you exactly what you need to do and when. Preparing properly is extremely important. If your colon isn't cleaned out, your procedure may be canceled, or you may need to have another colonoscopy, which no one wants. So I'll give you a general idea of what you may be asked to do leading up to your colonoscopy. The week or two before the procedure, your doctor may ask you to avoid aspirin or any anti-inflammatory drugs like Advil or Aleve, but acetaminophen like Tylenol are okay. 1 or 2 days before the procedure, you may be put on a clear liquid diet, and if you aren't, you may still want to eat light because the less food in your colon, the easier it is to clean out. A clear liquid diet includes things like water, broth, plain coffee, tea, and some kinds of popsicles, jello, and juice are usually okay. But you'll want to avoid any red, purple, or blue colored drinks, popsicles, and jello, because these colors can look like blood in your colon. Foods with nuts and seeds, because these types of foods can stay in the colon even after you take steps to clean it out, and they can clog the colonoscopy scope. And solid food or dairy products, including milk. The day before or day of the procedure, you'll start what is known as the prep. The prep is what cleans out your colon, so you'll need to go to the bathroom a lot. To help with this, you'll take either a cleansing drink, pills, or laxatives, or you may receive suppositories or enemas to use at home. But most people have the cleansing drink, so you'll either do all of the prep the day before your procedure, or you'll take half of the prep drink the night before your procedure and the other half the same day, several hours before your colonoscopy. This is called a split prep. No matter when you drink it, it's really important that you drink it all. Most people don't care for the taste, so your doctor may give you flavor packets to help it taste better. Some people also find it easier to chill and drink it through a straw. If the drink is making you feel queasy, take a break, then drink it a little slower. But if you can't finish it all, call your doctor. You may have to reschedule the procedure. After you finish all the prep drink, you'll know your colon is clean when all that's coming out is watery, diarrhea-like liquid that is light or yellowish in color. There may be some tiny brown bits in it, but there shouldn't be anything large or solid. The urge to go to the bathroom could start soon after finishing the prep, or it could come hours later. So for your comfort, try to do your prep someplace where you can be close to a toilet, and use alcohol-free wet wipes after you go to help keep that area from getting raw. After your colon is cleared out, you're prepared for your colonoscopy. Most people are given medicines before the procedure to be more comfortable. So you may get anesthesia medicine that will put you to sleep for the entire procedure. Or you may be given IV sedation, which is what most people get. With this, you'll get medicine through an IV to make you drowsy or even put you in a semi-awake state. You'll be aware of what's going on, but you won't remember much about the procedure. Many people describe the feeling of a colonoscopy as a slight pressure inside my colon. Not bad. Worrying about it was worse than having it. You may be able to feel the scope being placed, but once the scope is inside your colon, you'll only really feel sensations like stretching, bloating, or something similar to gas pain. So talk with your doctor about what they plan to do and your preferences. A colonoscopy takes about 30 minutes, but plan on being there for several hours. When you arrive, you'll go to a private area where you'll get your temperature, pulse, and blood pressure taken. If you are diabetic, you will also have your blood sugar tested. And they may also hook you up to some monitors like an EKG. Most people are given medicine at this time to help them be more comfortable during the procedure. Then the procedure will begin. Your doctor will do a rectal exam to make sure everything feels normal and healthy. Then a sterilized, lubricated scope is gently placed in your rectum. The scope is a long, hollow, lighted tube about as big around as a finger. It has a tiny camera that sends a picture to a TV screen so the doctor can see the inside of your colon. The scope blows a little air or water into your colon. This makes it easier to steer the scope and helps the doctor see. When the scope goes in, it may feel like you need to go to the bathroom, but don't worry. Your colon is pretty cleaned out, and this feeling should go away in a little bit. Your doctor will look around for things like polyps or areas that looked inflamed. If anything is found, they'll remove it or take a sample to send to the lab for testing. And if the doctor sees any bleeding, they'll use a special tool to seal it off and stop the bleeding. You won't be able to feel this. The goal is to move the scope all the way to where your colon meets your small intestine. But sometimes the scope can't get this far. If the colon has some extra tight twists and turns, the scope can get kinked and can be hard to move. Or sometimes scar tissue or other problems in the colon block the scope so it can't keep going. If this happens, your doctor will decide if any other tests are needed to see the rest of your colon. But in most people, the scope reaches this spot just fine. The doctor then slowly backs the scope out, taking another look at your colon along the way. The scope is then gently removed, and the procedure is done. After the procedure, you'll go to recovery, where you'll be watched closely and may get fluids through your IV. If you had anesthesia or sedation, you may feel a little groggy and will need to rest for about an hour until you're fully awake. During this time, it's normal to pass a lot of gas. Your care team expects it and knows it's going to help you feel better. Your doctor may come talk with you about what they saw. If any polyps or samples were taken, you'll have to wait a few days for those lab results. And in most cases, you'll be able to see the results in your patient portal as soon as they're available. Since you may still feel a little out of it, you may forget parts of the conversation, so you might want to have a family member or trusted friend there with you. Someone will need to drive you, but you will be able to go home later that day. When you get home, try to take it easy for the rest of the day, and if you can, have someone stay with you so they can help you out. You may feel bloated, gassy, or have cramps. It is a good idea to drink plenty of water, but avoid alcohol and caffeine for the day. If you have sedation, alcohol can be dangerous, and caffeine can give you more cramps. You should be able to eat normal foods like baked chicken or cooked veggies, but it's a good idea to start with something light. So ask your doctor what they recommend. And you can get back to normal activities like work or exercise the day after your procedure. But over the next few days, your colon will be readjusting. Since your colon was cleaned out for the procedure, it could take a few days for you to have a bowel movement. So going to the bathroom won't be quite normal. And there may be a little blood when you go to the bathroom. A little blood is okay, and it should stop in a day or so. However, call your doctor if you have a lot of pain, bleeding, or large blood clots when you go to the bathroom. These can happen even many days after a colonoscopy, a new fever, or a swollen, firm, or tender belly. These problems can happen right after or several days after a colonoscopy. If you experience anything unusual or if something just feels wrong, don't be afraid to contact your care team. You know your body best. Colonoscopies are very safe procedures that are important for your health. Millions of colonoscopies are performed each year in the United States, and your care team is trained to help you have a safe and successful procedure. But like any procedure, a colonoscopy has some risks. Injury to the colon. There's a small risk that the scope or any of the special tools that are used could injure your colon. In the days after your colonoscopy, the following could be signs that you have an injury: pain in your belly that doesn't go away, a fever, or a lot of bleeding. If this happens, you may need to have the injury repaired with surgery. Unexpected bleeding during or after the procedure. It's normal to have some bleeding during the procedure, but there's a chance you may lose more blood than expected. The risk of bleeding is more common when a polyp or tissue is removed. Usually, doctors can control any bleeding during the procedure. Rarely, a blood transfusion is needed. Although banked blood is checked for diseases like HIV/AIDS or hepatitis to make sure it's as safe as possible, there is still an extremely small chance you could get a virus or your body could reject the blood. Also, in rare cases, you may have bleeding on the inside of your body in the days after the procedure. If this happens, a colonoscopy or surgery may be needed to fix the bleeding. Signs of internal bleeding include a large amount of red blood when you go to the bathroom, dark red or black stool, severe pain, and a high fever. If you think you may have bleeding, please call your doctor or seek emergency help right away. Bad or allergic reaction to the anesthesia, medicines, or materials used during the procedure. Your healthcare team will be monitoring you closely for signs of any allergic reaction. If they see any kind of reaction, they'll treat you quickly. But in extremely rare cases, people can die from an allergic reaction. A polyp or problem could be missed. While doctors do their best to find and remove all polyps, these or other problems can be missed. They can be missed if the prep wasn't completed fully or if a patient eats something red, blue, or purple before the procedure. Colon problems can also be missed if they are very small, hard to see, or because the structure of a person's colon makes it harder for the doctor to find it. If this happens, you may be asked to repeat the prep and have another colonoscopy. There are a few alternatives to a traditional colonoscopy. One is called a stool test. Starting around age 45, you can have this test every year or every 3 years depending on the test. With this test, they check samples of your waste or stool to look for blood you can't see on your own or for possible signs of cancer. Some types of tests test the stool sample for blood and certain DNA in the cells. With most stool tests, you won't need to prep or change your diet before you do them, but some may ask you to lower your vitamin C or red meat intake for 3 days prior to collecting the sample. You typically won't need to go into the doctor's office either, because the kits can be mailed to you. For some tests, you put a small sample of your stool in a special container and mail it to the lab. For other tests, you'll be given special cards and asked to smear samples of your stool onto them using an applicator stick and mail the cards to the lab. You'll need to get the samples to the lab within a certain amount of time to ensure accurate results. And if anything is found, your doctor may have you come in for a colonoscopy. Another test is something called a virtual colonoscopy. This may or may not be covered by your insurance. And in most cases, the colon needs to be cleaned out, so you still need to do the prep. And if a polyp is found, you'll still need a colonoscopy to remove it. Here's how a virtual colonoscopy goes. In the hospital, a tube is put in the rectum and the colon is filled with air. Then the colon is scanned using a special X-ray called a CT scan, and a computer creates a picture of the colon for the doctor. There's also a device called a colon capsule. With this, you swallow a little device the size of a vitamin that has a camera in it, and it creates a picture of the colon before you pass the device in a bowel movement. This may not be available or covered by your insurance, and you still need to do the prep with it. Okay, the last option is something called a sigmoidoscopy. This is very similar to a colonoscopy, but it only looks at the rectum and at the lower part of the colon. So you'll still need to do a prep, but it may only require cleaning out the lower part of the colon instead of the full colon. Any of these tests may be a good option for you. It depends on things like your age, your family history, and whether or not you're already having any problems. But when doctors want to get a close-up look and take samples from the whole colon, a colonoscopy is the best option. And if they need to remove polyps they can only get to with a colonoscopy, it may be the only option. So know that when you get colon screenings, you're helping to protect your current and future health as well as the health of your family. This is because colon and rectal cancers tend to run in families. So if your colonoscopy or another test finds anything unusual, you can let people in your family know, and they'll be able to get looked at sooner instead of later. Getting checked regularly is important for you